Hello, this is the second lecture for nursing first year, Human Anatomy 1. Good. Last time we have started about nervous system. We have seen cell of nervous system, function of nervous system, some parts of spinal cord as well as brain, and we are left with cerebellum. So we have stopped here at cerebellum. So today we will continue with the second largest part of brain, that is cerebellum. So cerebellum is the second large part of brain, which occupies the inferior and the posterior aspects of the cranial cavity. Cerebellum consists of two cerebral hemispheres, like that of cerebrum. Cerebrum also have right and the left cerebral hemisphere. Cerebellum again, it has two cerebral hemisphere, right and the left cerebral hemisphere, which are located posterior to medulla on the pons and below the cerebrum. The surface of cerebellum, like that of cerebrum, and the other parts, the outer part is cortex, which contain a gray matter, and the inner part is white matter. Deep within white matter, you will have a number of mass of gray matter. This is what we call it cerebellar nuclei. Don't forget, we will have no nucleus of cranial nerves in cerebellum, but we will have other cerebral nuclei. Cerebellum attached to the brain stem by bundles of axon. This axon is called as cerebellar peduncles. So the cerebellar peduncles connect cerebellum to those structures which are found anterior to the cerebellum. What are these? Brain stem. Did you forget? Did you know about cerebral brain stem? There are major three types of brain stem that we have seen last time. Superiorly midbrain, the middle one is pons, and the lower one is medulla oblongata. There are three. So you will have major three cerebral peduncles that connects this brain stem, this three part of brain stem to cerebellum. The superior one that connects cerebellum to brain stem, superior part of brain stem, that is midbrain. That is superior cerebral peduncles, which attach it to pons, middle cerebral peduncles, and which attach it to the lower part. Which one is the lower part? Medulla oblongata is inferior cerebral peduncles. So don't forget, cerebral peduncles is connected into three: superior, middle, and inferior. So this helps for the passage of different kinds of sensory nerves. It can be those which is moving upwards to the cerebrum or downward from cerebrum. They can pass through this cerebral peduncle. So it simply helps for attachment and communication, the passageway between cerebellum and brain stem. So don't forget the three. As you observe here what we observe here is cerebellum. Have you observed it here? Is it visible? Good. So check it here. Here is the outer part, the gray matter, what we have said, and the inner part here is the white matter. And the peduncles is here, superior peduncles, middle peduncles, and inferior peduncles. So these peduncles are connecting with brain stem. Here is medulla oblongata, here is to the pons, here is to the to the midbrain. So superior peduncle to midbrain, the middle one to the pons, and the inferior one to medulla oblongata. Don't forget it. Good. The other is arterial supply to brain. What are the artery supply or blood supply to the brain? These are from different two sources. These are internal carotid artery branches and vertebral artery branches. Internal carotid artery branches are major branches like anterior cerebral artery, middle cerebral artery. And from vertebral parts like basilar artery are there, posterior cerebral artery are there, anterior spinal artery are there. Just as you observe from the figures here, there are from two different sources. Don't forget, internal carotid artery is from common carotid artery, which is directly from arch of aorta, but vertebral artery is coming from what we call it, coming directly from subclavian arteries. Good. Observe this figure now. what we have said, the two sources is the internal one. Here from the figures, yes, you can observe from the figures here, this is internal carotid artery. Internal carotid artery on both sides, right and the left. This internal carotid artery will give you two special branch. Here is special branches, anterior on both sides, right and the left, anterior cerebral artery, and here is medial cerebral artery. The two branches from this one. The other is when you come down, here is what we call it vertebral artery. Here the right and the left vertebral artery are coming together and forming basilar artery. It is basilar artery which have major 5 branches. As you observe here, these are the major different branches. Just you can say pontine artery are there. You can say labyrinthine artery are there. AICA anterior inferior cerebral artery are there. Here, as you observed, superior cerebral artery are there. Here is posterior cerebral artery are there. The last branch, posterior cerebral artery. Therefore, observe it. Look now. From this 5 branch of basilar artery, posterior cerebral artery, or simply we call it PCA, posterior cerebral artery is the last branch, which communicate with a branch with that of internal carotid artery. This branch which communicate with this branch is communicating artery. We call it posterior communicating artery. So we will have a special 2 communicating artery. One is posterior communicating, attaching posterior cerebral artery to internal carotid artery. 1. Second communicating is communicating anterior cerebral artery on both sides to each other. Anterior communicating. Here is anterior communicating. Therefore, look, observe now, they form circle. Have you seen? Here is a circle. This circle is named as circle of Willis, which have how many branch? 5 branch. Posterior cerebral artery, posterior communicating artery, internal carotid artery, anterior cerebral artery, and anterior communicating artery. These are major 5 branch of circle of Willis or circular arteriosus. Why we say circle of Willis? Because they form a circle. Have you seen? They form a circle. So don't forget, I will ask you this question. There are 5 branch of circle of Willis, and there are 5 branch of basilar artery again. Identify this. One question: which one have communication with both circle of Willis and the basilar branch? It is PCA. Both basilar branch and with this one here is the PCA. It have a communication. So it is a component of both circle of Willis and the basilar branch. The other, from branch of internal carotid artery, which one is not component of circle of Willis? Middle cerebral artery. Have you seen this middle? This middle on both sides, it is out of the circle. So it is not component of circle of Willis. So this is arterial supply of the brain, in which simply from 2 branches, internal carotid and the vertebral branch. And what are these branches? Don't forget. The other, when you come downward here, from vertebral artery, before vertebral arteries are coming to each other, attached to each other, they will give you 2 special branch. One is this small branch on both sides. This is small branch, have you seen? This is what we call it PICA, posterior inferior cerebellar artery. PICA, posterior inferior cerebellar artery. And the other branch here, you observe at the middle, at the center here, they will give you anterior spinal artery. These 2 arteries branch from vertebral artery before vertebral artery are coming to each other and before they form basilar branch. So don't forget this. At least I will ask you 2 questions here. 1, what is the components of basilar artery? 1. Second, mention and elaborate or explain all components of circle of Willis. How many branches of circle of Willis? There are major 5 branches of circle of Willis. Again, there are major 5 branches of basilar artery. Don't forget them. The other is ventricle of the brain. Ventricle of the brain is simply a fluid-filled ventricles which is lined with ependymal cells. Don't forget about ependymal cells. It is one of neuroglial cells we have seen last time, which helps for the production of cerebrospinal fluid. Ventricle of the brain is different from ventricle of the heart. Ventricle of the heart is 2, but ventricle of the brain is 4. So this is derived from cavity of neural tube, which is filled with cerebrospinal fluid. What's the main function of cerebrospinal fluid? One, transportation, simply transport nutrient, waste, and hormone. The other is for protection and for buoyancy. That means it reduces the weight of the brain, mostly that of cerebrum, from 1.4 kilogram by 50 gram. So it decreases the pressure at the base of the brain. So don't forget. So how many? Sorry, how many parts of ventricle of the brain? There are four. Don't forget. These are named as. So let me come to the first figures. Lateral ventricle, which is found here. Lateral ventricle here on the right and the left. Two lateral ventricles. Two lateral ventricles. The other is here, as you observe, third ventricles, which is found between the thalamus. Third ventricle between the thalamus. Again, the other is found here. Fourth ventricle between posteriorly cerebellum, anteriorly pons and the medulla oblongata. Pons and the medulla oblongata. So don't forget the four types of ventricle. Where is the location of lateral ventricle? It is found in the cerebrum on the right and the left. The right one on the right hemisphere, the left one on the left hemisphere, which looks like a C shape on the right side and the left side. The other is what we have said about that of third ventricle, a cleft-like, which is found between the thalamus. And the fourth one is located between cerebellum posteriorly and anteriorly between pons and the medulla oblongata. So located between the anterior border is pons and the medulla oblongata, posteriorly cerebellum. Good. So these are used for the one we have said for the formation of cerebrospinal fluids and for circulation of cerebrospinal fluids. Sorry, just I'm caused by cough. Sorry. Good. So in the lateral ventricle, it is where cerebrospinal fluid formation is started. It is started by choroid plexus, which is covered by or composed of pia mater, and there is location of ependymal cells again. These are coming together in the form plexus. Then production of cerebrospinal fluid started, and this circulation from lateral ventricle to the third ventricle, from third ventricle to the fourth ventricle. Don't forget, between lateral ventricle and the third ventricle, there is special opening, interventricular foramen of Monro. Monro is the name of the scientist which discovered this one. It is very small spaces located between lateral and third ventricle. From third ventricle to fourth ventricle, there is a special space again, what we call a cerebral aqueduct or aqueduct of Sylvius. It is space located between the third and the fourth. So the circulation of the fluid is from lateral to the third through the space of Monro, from third to fourth through the space of aqueduct. Again, from the fourth, it is going to leave the brain now. Two lateral openings are there, what we call it opening of or foramina of Luschka, and the one central opening which is going down to the central canal of spinal cord. It is what we call it foramen of Magenda. So there are two openings, lateral and the central openings. Through this opening, now it is going to leave the brain and it is going to store into subarachnoid space. Don't forget, last time we have seen meninges, 3 layers of meninges, covering of central nervous system, dura mater, arachnoid mater, and the pia mater. Space found between pia mater and arachnoid mater, subarachnoid space, which is used for storage of temporary storage of cerebrospinal fluid. Now, from this, it is going to be absorbed into venous drainage. This is superior sagittal sinus, venous, which drain into dural venous sinus. Then, now, CSF is leaving the ventricle of the brain and it is coming to enter into dural venous sinus. Then it is mixed with circulation now, blood circulation. This is all about the what we call it circulation of cerebrospinal fluid. Don't forget how many ventricle? 4 ventricle. The circulation from lateral ventricle to third ventricle, from third to fourth, and from fourth by 2 lateral openings and 1 central opening, it leaves the brain. So don't forget, when I asked you about circulation of cerebrospinal fluid, don't forget to write the space again, the valves or space which is found between ventricles. The other is cranial nerves. So cranial nerves are composed of, like spinal nerves are composed of spinal cord, cranial nerves are composed of brain. There are 12 pair of cranial nerves like olfactory nerve, optic nerve, oculomotor nerve, trochlear, trigeminal, abducent, facial, vestibulocochlear, glossopharyngeal, vagus, accessory, and hypoglossal cranial nerves. Please don't forget their number. They are going to be written by Roman numbers. So what is number 1 means, what's number 2, number 3, just identify like that. Good. These cranial nerves, 12 pair of cranial nerves, all are distributed in the head and the neck except vagus nerves, because vagus nerve penetrates head and the neck and it's coming to thorax and abdominal region. The other all nerves except cranial nerve 11, part of 11 originate from brain, all of them from brain except number 11, the part which is arise from superior part of spinal cord. Good. Cranial nerves we are going to classify based on different criteria. The first one is based on the central location or attachments. Yes, we have seen this last time. Number 1 from here, from forebrain, telencephalon. Number 2 from diencephalon. 3 and 4, midbrain. 5 to 8, pons, and 8 to 12, medulla oblongata. So don't forget, this is central location. The second one is based on their function. Based on their function, we are going to classify as which are purely sensory, purely motor, and mixed. Purely sensory are number 1, number 2, and number 8. Purely motor are number 3, number 4, number 6, number 11, and 12. And mixed means both motor and sensory. That's number 5, number 7, number 9, and number 10. The third classification is based on their openings. We have said that they are arising from where? From brain. Once they arise from brain, how they leave the cavities, cranial cavities, through different openings. This opening we can classify roughly as anterior cranial fossa, middle cranial fossa, and posterior cranial fossa. Which opening is found in anterior cranial fossa? Cribriform plate, which is for the passage of cranial nerve number 1. Middle cranial fossa, optic nerve, for the passage of optic nerve. Superior orbital fissure, for the passage of cranial nerve number 3, number 4, number 5, and then number 6. Don't forget. Number 5, trigeminal. Let's classify into 3. Tri means 3. Trigeminal number 1, number 2, number 3. Only number 1. Trigeminal number 1 pass through superior orbital fissure. Trigeminal number 2 through rotundum. Number 3 through ovale. The other is posterior cranial fossas like foramen magnum, jugular foramen, and the hypoglossal canal. Foramen magnum is for the passage of spinal accessory nerves, number 11. Jugular foramen, number 9, number 10, and number 11. Hypoglossal canal, hypoglossal nerves. So based on this, we are going to classify cranial nerves. Now, roughly, let's see them one by one. What is the function of number 1? Olfactory, simply for smelling. Number 2, for vision. This damage of this means blindness. What about damage of number 1? No smelling means anosmia. Number 1, anosmia. Number 2, blindness. Number 3, oculomotor, simply movement of eyeball. You can rotate your eyeball in different direction. Opening of eyelids, constriction of pupil, and focusing again. Number 4 is used for movement of eyeball. It supplies superior oblique muscle. So this damage means its inability to rotate eye inferiorly and sometimes double vision again. Number 5, trigeminal. Tri means 3. Trigeminal. One is around the eye, ophthalmic. The other maxillary. The other is mandibular. Its main function is 1, sensory to the face, touching pain or temperature around the face, and supply muscle of mastication. Just those muscles which are used for chewing. When you are masticating, eating something, this will help you. Like these are special for muscle of mastications. The other is abducens, provide eye movement again. supply lateral rectus muscle, so it helps your eye to move it laterally. So the damage of this means inability to move laterally. You cannot move laterally if this muscle is damaged. The other is facial nerve. Facial nerve is supply muscle of facial expression, like wink at, closing your eye, opening your eye, closing your mouth. These are muscle of facial expression. And this applies your taste, your tongue again. Anterior two-thirds of the tongue, which is used for sweet and salty tastes. The other is vestibulocochlear. Vestibulocochlear, it is two nerves, the vestibule and the cochlear. Vestibule means for the balance, cochlear means hearing. That's why we say it is used for hearing and the sense of balance. It is damage means, don't forget, hearing is damage means deafness. Glossopharyngeal, it is supplying muscle of pharynx, so it is used for what? Swallowing. And it supply posterior two-thirds of the tongue. What's the function of posterior two-thirds of the tongue? It is used for, yes, bitter taste and sour taste. So this damage means you cannot identify bitter and sour tastes. The other is vagus nerves. Vagus nerve is the only nerve which crosses head and the neck and coming to the thorax and that of the abdomen. So its sensories. It is used for swallowing, for speech, for regulation of their damage causes hoarseness or loss of voice. Vagus nerve, because it is applied muscle of larynx. Function of larynx to voice box. So this damage means there is no voice, so impaired swallowing. It is fatal if it is damaged on both sides. The other is cranial nerve number 11, accessory. So it is the supplies like, as you remember, sternocleidomastoid muscle, trapezius muscle. So this helps for movement of your head and the neck. So this damage means impaired head and the neck, shoulder movements. The last one is hypoglossal nerve. So hypoglossal nerves is supplying skeletal muscle of the tongue, those which help the tongue for movement. It can be for speech. I'm speaking now because my tongue is moved. For manipulation, for swallowing. So if this damage on one direction, the tongue deviates toward the injured side. But if it is on both sides, you cannot protrude your tongue. So this is simply supply skeletal muscle of your tongue. This is all about the nervous system. If you have question, write me through WhatsApp. And your final exam is up to this again. Please don't forget your final exam up to hypoglossal nerve. That means including all central nervous system. See you next. Bye.